Hi everyone, welcome to another episode of BDI's vlogs series. Today I've got the really fun task of talking about the MRCEM and FRCEM exam. So we're going to talk a little bit about the different components. The examination route has actually changed a little bit in the last couple of years. So in August 2018 there was a bit of an alteration and a merging of the MCEM and FRCEM route. So we'll talk through why you would sit the exams, what you need to know about the different components and the prices, and why it would be beneficial to use that in your route to the UK. So first things first, why would I take the MCEM or FCEM exams? Who's it designed for? Well, if you're an emergency medicine doctor and you've got more than 3 or 4 years of experience of clinical practice within an ED, then this could be a really good way for you to gain your GMC registration and give you an edge when you're applying for jobs in the UK. The Royal College does advise that your English language levels need to be pretty good, obviously because the exam is administered in English. So I think they recommend that you should have roughly the equivalent of a 7 in each part of reading, writing, listening and speaking in IELTS in order to successfully pass the examination. So like I said, 4 years clinical practice really should be the baseline if you're going to do this. The reason that it's different from PLAB is that PLAB is just testing your competencies of a junior doctor to see if they're equivalent to a doctor that would be working at junior level in the UK. If you're applying to work in an ED here, then MCEM is a or FCEM as well, are very desirable qualifications to have, because it shows that you have a benchmark of clinical ability which is the same as what a doctor at an ST3 or ST4 level in the UK would have within emergency medicine. So if you've done PLAB, you're probably not going to get a job that's better than or higher than an ST3 level. If you've done MRCEM or FRCEM, then that gives you access to much more senior jobs. It also allows you to move much faster through the CSER process if that's the route that you're taking to specialist registration. But if you need to know more about CSER, then we've got other blogs and vlogs and podcasts that you can watch, or you can get in contact with us. Okay, so there have been a number of changes to the MRCEM and FRCEM exams, as we said, in the last couple of years. So previously, if you wanted to do MRCEM, there was one suite of exams, and if you wanted to do FRCEM, there was a different suite. And in 2018, the Royal College merged those two processes together so that it was much easier and more straightforward for people who are going to go down the FRCEM route. The first part of the ladder, or the progress if you will, is the FRCEM primary exam. Now that's a direct replacement for the MRCEM A exam that previously exists, but the format is the same. It's a 3-hour long 180 question short answer multiple choice based paper. So you'll be split into a number of different categories. It covers off anatomy, physiology, pharmacology, microbiology, pathology and evidence-based medicine, and haematology is still put in with the pathology part. It doesn't have its own section. So those are the kind of main topics that you would cover off within that first exam. And as I said, whether you're going through the MCEM route or the FCEM route, you would still do this one paper together. So the cost of this exam is £310. So if you are going to take a shot at it, obviously you want to be prepared and revise properly, because it's not the kind of thing that you want to waste your money on. But once you've completed that first part and doing the FCEM primary, then you can move on to the FCEM intermediate. Okay, so once you've completed the FRCEM primary exam, you'll then be eligible to sit for the FRCEM intermediate exam. Now, whether you're going down the FCEM route or the MCEM route, you'll have to sit the SAQ part of this. So it's called the FRCEM intermediate SAQ, which stands for short answer question. So there'll be another 3-hour exam. There'll be 60 short answer questions, and you'll be presented with a number of interpretations that you need to make and answers based a lot of the time on blood cultures, x-rays, ECGs that you're presented with, and asked to explain a diagnosis or a narrative and interpretation of that. Covers off main areas of general medicine, toxicology, ophthalmology, pediatrics, surgery, and that includes TNO, ENT, maxillofacial surgery, anesthesia, obstetrics and gynecology, and ethics and law. So there's quite a lot covered. You don't need as broad a depth of knowledge to pass this part of the exam, because it's a bit more focused, but it is still a hard one to take, and you should still provide at least 6 months of revision before each part of these exams. So it's quite important. The cost of that is £305. So again, it's not a cheap thing to do. So the SAQ part is a direct replacement for the MChem B exam as part of the old curriculum. If you're going down the FRCEM route, and you want to do the FRCEM final examinations, then there's an additional part of the intermediate exam that you need to sit, and that's the situational judgment paper for an additional £200. Now that's a 2-hour exam, and rather than being short answer question, is multiple choice again. So there's 120 multiple choice questions. You get 6 attempts at this exam only, and it's a direct replacement for the MChem Part C exam. If you've made any attempts at the MChem C exam failed previously, they don't count towards the 6 attempts that you get towards the SJP. Again, you're looking at clinical scenarios, and you have to choose the most effective treatment or action based on a question which you select from multiple answers. So they're split into 7 different areas. There's patient focus, problem solving, decision making, teamwork, professional development, professional integrity, and time management, and those are the sort of main additional areas that would be covered when compared to the SAQ part of the intermediate test. So quite a lot to take in there. Obviously the £200 difference is quite a lot of money, but if you're looking to go down the FRCEM route, then that's the one you should take. It's worth noting that if you're going to go for MChem and you think you might go for FChem in the future, you can go back and do just the situational judgment paper on its own, so you don't have to do the whole intermediate part again. Okay, so once you've done the intermediate part, you're then eligible to apply for the OSCE exam. Now, if you're just going for the MChem part, which is the bit that we would recommend for international doctors, given that it's a bit cheaper and it's probably quicker to pass, and that's the thing that can get you GMC registration, you would sit the OSCE exam. So this is an objective, structured clinical examination, which is structured like the PLAB exam. So you'll have different stations. There are 18 stations, which are 7 minutes each in length, and you'll have a mannequin or an actor pretending to be a patient. And an examiner will be watching you with a clipboard and making notes on how you interact. And the point of this final exam, which many people see as the hardest exam in the series, is that it's to test your application of the clinical skills that you have so far and your clinical knowledge in a sort of real life environment. So how would you interact with your patients, rather than your ability to remember facts or knowledge about medicine that you would have shown in the first 2 parts of the examinations. So the cost of this final part is £450. Again, is the most expensive part, but obviously you're covering the costs of actors, mannequins, all that kind of stuff. And if you can pass this part, then you would be able to receive your full MRCEM, so membership of the Royal College of Emergency Medicine. And with that, you can make your application to the GMC for a medical license, provided you've also passed the English competency test, so an IELTS or an OET test. Okay, so once you've got to the UK and you've done your MRCEM, you might want to continue down the route of doing the FRCEM examinations. So that will require a different OSCE examination. Slightly cheaper at £420, but certainly not cheap in its own right. And rather than being 18 7-minute stations, you have 16 8-minute stations. So the clinical scenarios and the observations will be slightly different. On top of the OSCE part, if you're going down the FRCEM full examination route, for the final examination route, then you need to do a critical appraisal short answer question, which is another £240. You'll need to do a clinical short answer paper, which is very similar to the intermediate short answer question paper in that it's 3 hours long with 60 questions. And you'll need to do a quality improvement project as part of your general practice within your organisation. So you do that generally at your sort of ST4 and at ST6 levels, and that's done whilst you're in the UK, and that's about £150 to complete. So additional costs, more involvement, but obviously apart from the that final examination suite and the situational judgment paper as part of the intermediate, the same exams as for your MChem. So as an overseas doctor, what should you do? Well, the best thing that you can do, and the thing that's going to be accessible to you, is the MRCEM exam, because without being in the UK and doing the quality improvement project and the other additional parts of the final FCEM examinations, you would need to be in the UK to complete the FRCEM, really. So MRCEM should be what you're aiming at. If you're going to do the FRCEM primary paper, then you can sit that in either the UK, Iceland, Malaysia or Oman. And if you're going to do the intermediate part, you can do that in again in the UK or Malaysia or the UK. And if you're going to do the OSCE part of the MChem, you have to do that in either Malaysia, the UK or India. Those are the sort of main test centres. So the total overall cost at the end of that is going to be £1,065. So it's not cheap, but it is an investment in your future, because once you have MChem, you will find it very easy to find a job within ED in the UK. Obviously you might need some help with your CV, you might need some help organising interviews, and that's something that we definitely can help you with. But MChem is the thing that every hospital in the UK will ask for from an ED doctor if possible. As I said, it's sort of a guarantee of the quality, the rigorous exams that we've just talked about. It tells a hospital in the UK that you are a good, solid ED doctor with the same experience that they would expect from a UK trained physician. So definitely worth doing. If you're going down the PLAB route, you won't have as many options. We'll definitely still be able to help you get a job, but if you can go down the MChem route, then that is the way that we would definitely recommend that you go. Once you arrive in the UK, if you then want to pursue specialist registration through a CSER or formal training program, you would ultimately end up doing the FRCEM examination, so the additional situational judgment paper that we mentioned during the intermediate, and then the other clinical and critical appraisals and quality improvement projects as part of the final suite of exams, and then the price for those goes up. So at the end of that, you'll have spent a total of £1,925 through your education within emergency medicine. So to summarise, the best advice I can give for now is, if you're overseas and you're looking to get to the UK, MRCEM is the route to take. FRCEM primary paper, the FRCEM intermediate paper, and then the MChem OSCE. So those three main exams, they're the ones that you should be aiming for. And once you've completed that, you'll be able to sit your English language test and then apply for your GMC registration. And emergency medicine is one of the specialties that we are always asked for by hospitals, so we'll definitely be able to help you find a job. Okay, thanks very much for watching. I hope you found that helpful. If you do have any other questions, or you need some help with your CV or finding a job and moving to the UK, please feel free to contact us. There's lots of other really good content on our blogs, our other vlogs, our podcasts, and on our website as well, and also in our Facebook and online community. So do feel free to contact us, and we'll see you next time. Thanks very much.